KMA delegates, KMA members, friends, and honored guests. I want to welcome you to the 2020 KMA annual meeting via this virtual platform. I also want to humbly thank each of you for electing me as your KMA president for 2020 and tell you that this is one of the biggest honors and biggest thrills in my life. I want to say at the beginning of my comments that this was not supposed to be me this year. This was supposed to be Bob Couch's presidency and inaugural address. As everyone knows, Bob tragically and sorrowfully passed last November. I had the great fortune of getting to know Bob through our mutual leadership roles in the KMA, and I can say that he worked and advocated tirelessly for his patients, his fellow Kentuckians, and the KMA. If I can be half the KMA president that Bob would have been, then I will be a success. My own personal thoughts and prayers are with Bob's family, as I know the thoughts and prayers of the entire KMA body. I also want to thank Brent Wright for the superb and exemplary job that he did this past year as KMA president. During the first half of his year as president, he was everywhere, from Paducah to Louisville to Frankfort to Lexington and to Northern Kentucky, to Ashland and to multiple cities in between. Then, with his second half of the year and the COVID-19 crisis, he was the calming voice of the KMA that reassured KMA physicians, non-KMA physicians, and all Kentuckians. Yet somehow, in the midst of all his busyness, he managed to practice medicine. Brent has been a very important mentor for me as I begin my presidency. I remember Brent saying during his presidential inaugural speech last year that he had big shoes to fill from Bruce Scott's preceding presidential year. Well, Brent, I have equally big shoes to fill this year. I want to thank my parents, Louis and Nadine, my siblings, Ken, Steve, and Janice, and their families who have supported me throughout my career and life. They have been supportive, have kept me humble, and have been some of the strongest influencers in my life. I want to mention and thank many numerous colleagues and people who have helped me throughout my career and directly and indirectly led me to this peak of my career. Like most other active KMA members, I initially became involved in my local medical society, which in my case, I'm very proud to say is the Lexington Medical Society. Carolyn Kurz was the LMS Executive Vice President and CEO when I joined in 1991 and was very influential and helpful in encouraging me to become more and more involved. Following Carolyn's retirement, Chris Hickey became the current Lexington Medical Society Executive VP and CEO and has continued his support as I have become more active and involved in the KMA. David Benzema was my chief resident during my residency at UK and has been my mentor at LMS and KMA. I was David's alternate trustee to the KMA Board of Trustees and have been proud to follow his KMA footsteps. As KMA trustee, vice chair and chair of the Board of Trustees, vice president, and now president. David has always been supportive and always encouraged me to make that next step in organized medicine. Andy Polito has been a mentor and an example of how to be an active UK faculty member, which is where I work, and still be an active KMA member, including president. Terry Grimm was a fellow medical school classmate who joined the Lexington Medical Society and Kentucky Medical Association the same year that I did. We always sat together at the LMS meetings and then became active together at the LMS and KMA, and we just had fun together at the meetings. Lastly, Pat Paget, Vice President and CEO of the KMA, has been the facilitator and supporter of me personally and then just made it happen for me at the KMA. Carolyn, before her retirement, and now Chris and Pat have all recognized how busy physicians are, but at the same time realized how important the work is that we do in organized medicine. And they have all helped and to make it happen. In addition to Carolyn, Chris, and Pat, are the wonderful LMS and KMA staff, and together they streamline the process to make it efficient and effective for the physician to accomplish such extraordinary feats. So let me encourage every KMA physician who has been hesitant to get more involved because you are too busy to just try it. If I can do it, then you can do it too. Due to the COVID-19 crisis and subsequent virtual KMA annual meeting, there is no presidential dinner and no accompanying president's head table at the dinner. However, I want to specifically mention these special people in my life and medical career who I would have invited to sit at my head table. My family, Carolyn Kurz, Chris Hickey, Pat Paget, David Benzema, Andy Polito, and Terry Grimm. My presidential theme and focus for this year is in conjunction with the Kentucky Foundation for Medical Care and will be Well, Stay Well. This will be directed to all Kentuckians and to all physicians and healthcare providers. I'm a general internist at UK who's had the privilege of providing primary care for multitudes of patients for 30 years, including many of my colleagues who are physicians and healthcare providers. I work with residents at UK and always remind them that our job as primary care providers is twofold: identifying the issues or making the diagnosis, and equally important is convincing the patient to do what we recommend. So throughout the year, we will identify important issues and subsequent ways to improve physical and mental health of Kentuckians and Kentucky physicians. And then we will also spend time convincing the public and physicians to heed the advice. In full disclosure, I will be talking to myself with all of these issues as well. Topics that we will address throughout the year will include healthy living, getting enough sleep, exercising, avoiding obesity, not smoking and avoiding all tobacco products, drinking alcohol in moderation, managing mental health, obtaining recommended vaccinations, attending regular well visits with your physician or provider, and specifically for physicians to not just use curbside visits. Of course, with the current COVID-19 crisis that seems to be continuing, we will also address proper social distancing, wearing masks, and hand washing. We will also have multiple physician and provider-focused programs and information with particular emphasis on preventing physician burnout and managing stress. The Be Well, Stay Well campaign will be presented throughout the year in conjunction with the Kentucky Foundation for Medical Care and a number of existing and new KMA efforts and platforms, including presidential messages that are written and pre-recorded to members for posting on our website, social media, public health minute videos, op-eds, radio public service announcements, and possible television spots on the local news or KET. We may be able to have a standing column in medical news or MD Update written by different physicians with tips on staying healthy in a standing column in the Kentucky Board of Medical Licensure newsletter. We anticipate being able to partner with various specialty groups aligned with the campaign focus, make in-person appearances at existing health and wellness events, offering physician speakers or materials for distribution, and offer an in-person event at the state capitol with Be Well, Stay Well targeted messages for legislators. I'm very happy to report that Anthem has given a $25,000 grant to help fund the distribution of this message. I will also mention that one of my areas of expertise is identifying and facilitating the brilliance of my colleagues, including my fellow KMA members. So the foundation and I will need help with a lot of this, and I plan to be calling on many of you to help showcase your talents and help with many of these activities. Working together in the KMA, We will be stronger and we will achieve great things in 2020 to 2021. I want to conclude my address by reiterating how honored and humbled I am that you have elected me to this esteemed position. I promise that I will do my best in this role. Please contact me for anything at detone0@uky.edu or text me at 859-339-7191. Thank you very much.